In hypovolemic shock, this is a type of shock that will actually establish that what the fluid levels of the body or the blood levels are actually low, right? So if blood levels in the body are low, that means the organs are not getting the adequate blood supply that they should get. So there's a way your organs will respond to this, okay? So that's why we're saying there's an organ response in the progression of pathophysiology. Pathophysiology like step-by-step progression of hypovolemic shock. So hypovolemic shock, first of all, you should know that what? The fluid levels in the bodies are reduced, okay? So say blood levels are reduced. Now, reduced perfusion of the kidneys cause the juxtaglomerular cells to generate renin, and this can activate the RAS pathway. Okay. Then intestinal ischemia, that's like your intestines are not receiving enough blood, so it's causing an ischemia. Intestinal ischemia will alter the mucosa, and thus this can make way for microbes to invade the intestine in the intestinal wall. Okay, they can also invade the circulation, and this can cause the whole body responding to this this can cause what? The whole body responding to what? The infection, which is known as sepsis. So thus, the neurohormonal and inflammatory responses are supposed to be transient, maintaining vital function during the period of metabolic stress. However, if the stress is prolonged, the effect becomes what's counterproductive. So talking about other organ responses, okay, if there's a decrease blood flow to the brain, you'll be having things like dizziness, you'll be confused, coma, all right, and the rest. Then also, if there's a decreased blood supply to the lungs, that means what? Okay, the lungs will not be having enough blood to oxygenate. So now, this will now show up on the rest of the body. All the cells will now be suffering from what? Blood supply. Can you see how their hands is kind of like discolored? So your hands are basically what? Trying to become discolored and all that, right? So, but the basis of this is this. Decreased blood supply to any organ will cause a cell, the cells of that organ to suffer. So if you know the function of that organ, you can just say that, okay, this function will not be there or will be reduced, okay? That's just the basics of what organ responses in pathophysiology of hypovolemic shock.